Cortisol tests for stress response and stress-related insomnia. Stress is a common part of life, but when it becomes chronic or excessive, it can lead to various health issues, including sleep problems. Cortisol, often referred to as the stress hormone, plays a crucial role in our body's response to stress. Cortisol tests are used to assess cortisol levels in the body, providing valuable insights into stress response and its impact on conditions like stress-related insomnia. What are cortisol, to assess stress response, and cortisol, for stress-related insomnia? Cortisol, to assess stress response, and cortisol, for stress-related insomnia, are two different types of tests that measure cortisol levels in the body. Cortisol, to assess stress response. This test measures the levels of cortisol in your blood, urine, or saliva to assess your body's response to stress. It helps determine whether your body is producing too much or too little cortisol in response to stressors. This test is primarily used to identify conditions related to excessive or insufficient stress hormone production. Cortisol, for stress-related insomnia. This test also measures cortisol levels, but it focuses on understanding how cortisol may be contributing to sleep problems, specifically insomnia. It helps identify whether high cortisol levels at night might be causing sleep disturbances. This test is particularly useful for individuals struggling with sleep disorders that may be linked to stress. Why cortisol, to assess stress response, and cortisol, for stress-related insomnia. Cortisol is a crucial hormone produced by the adrenal glands in response to stress. It serves several essential functions in the body, such as regulating metabolism, immune response, and blood pressure. Understanding cortisol levels is important for the following reasons. Stress management. Cortisol tests help individuals and healthcare professionals assess their stress levels. High cortisol levels over an extended period can lead to health problems like anxiety, depression, and cardiovascular issues. Managing stress is essential for overall well-being, and cortisol tests provide valuable data to inform stress reduction strategies. Sleep disorders. High cortisol levels, especially at night, can disrupt the sleep-wake cycle and lead to insomnia. Cortisol tests can help diagnose the underlying cause of sleep problems and guide treatment options. For those suffering from stress-related insomnia. Common cortisol, to assess stress response, and cortisol, for stress-related insomnia, tests. Cortisol testing is typically done through blood, urine, or saliva samples. The choice of test depends on the specific purpose and circumstances. Blood test. A blood test measures cortisol levels in your bloodstream. It is commonly used to assess general stress response and diagnose conditions like Cushing's syndrome, excess cortisol, or Addison's disease, insufficient cortisol. Urine test. A 24-hour urine cortisol test involves collecting urine samples over a day to measure cortisol excretion. This test is useful for assessing cortisol levels over an extended period and diagnosing conditions like Cushing's syndrome. Saliva test. A saliva test measures cortisol levels in your saliva at different times of the day. It is often used to assess cortisol's diurnal, daily, rhythm and can help identify issues related to stress response and insomnia. Interpreting cortisol, to assess stress response, and cortisol, for stress-related insomnia, results. Interpreting cortisol test results should be done by a healthcare professional, as the meaning of the results can vary depending on the individual's specific circumstances. Generally, high cortisol levels may indicate chronic stress, while low levels may suggest an adrenal insufficiency. Cortisol, to assess stress response. Elevated cortisol levels may suggest chronic stress, anxiety, or Cushing's syndrome. Low cortisol levels may indicate adrenal insufficiency or Addison's disease. A healthcare provider will consider your medical history and symptoms when interpreting the results. Cortisol, for stress-related insomnia. High cortisol levels at night may be contributing to sleep disturbances. A healthcare provider will assess these levels in the context of your sleep patterns and other relevant factors to determine appropriate treatment. How the test is conducted. The procedure for cortisol testing varies depending on the type of test and the healthcare provider's preferences. Here is a general overview. Blood test. A healthcare provider will draw a blood sample, typically from a vein in your arm. The timing of the test may vary, as cortisol levels naturally fluctuate throughout the day. Urine test. For a 24-hour urine cortisol test, you will collect all urine produced over a full day. The samples are then sent to a laboratory for analysis. Saliva test. Saliva samples are collected using a swab or a special collection device. Multiple samples may be taken at different times of the day to assess cortisol's diurnal rhythm. For whom is this test for and what diseases this test is for? Cortisol testing can be beneficial for various individuals and conditions. Individuals experiencing chronic stress. People facing prolonged periods of stress can use cortisol tests to assess the impact on their health and develop stress management strategies. Those with sleep problems. Cortisol tests for stress-related insomnia can help individuals struggling with sleep disorders pinpoint the underlying cause and seek appropriate treatment. Patients with suspected hormonal imbalances. Cortisol tests are crucial for diagnosing conditions like Cushing's syndrome, high cortisol, or Addison's disease, low cortisol. Healthcare professionals. Healthcare providers may use cortisol testing to monitor patients with known adrenal issues or to investigate unexplained symptoms. In conclusion, cortisol tests play a vital role in assessing stress response and its impact on health, including stress-related insomnia. These tests provide valuable information to individuals and healthcare professionals, helping them manage stress, diagnose hormonal disorders, and develop tailored treatment plans. If you believe you may benefit from cortisol testing, consult with a healthcare provider to determine the most appropriate test for your specific needs. Remember that managing stress and addressing related health concerns is essential for a happy and healthy life. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.